I really appreciate you all showing up tonight. I know your time is very valuable. And so let me gift you something, and then we will all go about our own ways and have a great night. So I'm going to just talk for about 20-30 minutes, and then I'm going to take a 10-minute break. AJ will answer some technical questions about class times and such, and then I'll come back after my 10-minute break, and I'll be here to answer some more questions and chat with you. Okay, introduction to electroacupuncture medicine. So what is electroacupuncture medicine? And here's the table of contents. The most important thing on this for you guys is the second to last thing, the systemic analgesic treatment protocol, which I'm going to be teaching you before the end of the night. You guys can use it on all your patients starting tomorrow. I know I use it on all my patients, almost all of them. Here we go. Okay. So what is electroacupuncture medicine? Electroacupuncture medicine is the use of acupuncture needles stimulated with pulsed electrons that trigger the release of neurotransmitters, or to modulate and regulate human biophysiology. What type of patient can benefit from EAM? So these first few slides, we get started a little bit slow, but it's going to pick up pretty fast here. Patients with chronic pain and inflammation that have tried everything else, even manual acupuncture. Acute pain patients will also benefit, and deficient or weak patients are helped, not harmed by electroacupuncture treatments. This is a big misconception, and I'm going to break this misconception for you by the end of the webinar. So we all know the body is electric. We've spent 2 or 3 or even 4,000 hours studying Chinese medicine. And so we know that there are different aspects of the body that act like batteries. There's charged ions such as sodium, potassium, magnesium, and calcium. We know the body is electric because it's in medicine. It's even in allopathic medicine. When we use the electrical measurements of the brain, we call that an electrocardiogram. And of course, cardiologists know the heart is electric. The interesting thing about the heart is that it's innervated by both the parasympathetic and the sympathetic autonomic nervous systems. And why is this interesting? Because it just validates why classical Chinese medicine practitioners can diagnose a person from the pulse. So now this slide is demonstrating effects of electrons, and the next few slides we're going to be talking about electrons. What's the big deal about electrons, right? Okay, so here is blood cells, and on the left-hand column is a lack of electrons on the surface of the blood cell, and on the right-hand column is a zeta potential, or negative charge. It's when the electrons build up on the outside of the blood cell, and negative repels negative, and you can see the free-floating blood cells on the right-hand side. Now, why is this important? Because almost everybody I see in clinic has some sort of electron deficiency, and let's say we're stimulating endorphins to get rid of their pain. How's that endorphin molecule going to get through this clumpy blood? So the bottom line for this is that electrons are extremely important in all aspects of physiology. Electroacupuncture is benevolent. I already told you the body's electric, and you already know it. And electricity is benevolent, and when EAM is performed properly, it is not damaging. So electrons are also known as antioxidants. How many of you knew that? They are negatively charged particles, and you all are at the forefront of this medicine. So acupuncturists and other physicians are the most qualified to use electrons as medicine. So you're already great at doing acupuncture for a profession. And now I want to have you start exploring adding electrons as medicine to your acupuncture. There are sources of free electrons, and there are sources of electron stealers. So free electrons are things like antioxidants, vitamins, minerals, nutrition, and guess what? Our machines. Our machines have batteries with the same free electrons waiting for you to help your patients. Now, we all know sources of electron stealers. These are toxins, infections, scars, electromagnetic pollution, drugs, vitamins, and some hidden dental work can also be a problem for draining free electrons. So here we have the most important antioxidant in the world. That's Sour Patch Kids, followed by Sour Skittles and also Sour Sketty. And of course, vitamin E, bicarbonate, beta carotene, the list goes on and on. I'm sure you guys all studied these sources of free electrons or antioxidants. But what I've seen is that we can't really take enough orally to make up for all the daily stressors and toxins that we're experienced in today's society. So I wanted to spend a minute talking about the stomach in Chinese medicine. And stomach acid is yin, and electrons are yang. And I want to thank my wife for teaching me that. And so stomach acid is yin, right? And we need strong stomach acid to digest minerals, vitamins, amino acids. And the stomach acid should be about a 2 pH. And when it's not, and the food and the acid dump into the small intestine, then no electrical signal goes to the top of the sphincter of the stomach to close it. So I'll repeat that. When we have strong stomach acid, it goes into the small intestine with the food. That sends an electrical signal to the top of the stomach, and the stomach actually closes to prevent acid reflux. So acid reflux, heartburn, it's a symptom of malabsorption, and it's a symptom of stomach yin vacuity, which is not enough stomach acid. Here we get into the effects of electroacupuncture medicine. So using frequency-specific pulses of electrons, we can trigger the nervous system to secrete molecules such as analgesics and anti-inflammatories. We can also use pulses of electrons to stimulate specific nerve pathways, such as the vagus nerve, which modifies the balance of the autonomic nervous system. So let's pick this apart because it's very important. This first phrase is saying that if you use a low frequency for 20 minutes, it's going to trigger the pituitary to upregulate the production of beta endorphin, which is an endogenous opioid, as well as in equimolar amounts ACTH, which is a precursor to cortisol, which is a glucocorticoid steroid. And these molecules, they dump into the blood from your treatment, and you're able to help your patients by giving them this molecule from their own pituitary. The second line on this is talking about how we can regulate organ function, such as the studies done by Dr. Tracy, where he implants an electron pulsed stimulator here in the neck to stimulate the vagus nerve to turn off tumor necrosis factor in the spleen to cure rheumatoid arthritis. But it's not really a cure because when they shut the stimulator off, the rheumatoid arthritis returned. However, this demonstrates an example of what we can accomplish using electroacupuncture. Okay, when I learned the nervous system, it was a series of wires that transmitted signals to and from the peripheral and central nervous systems. And while that's correct, I want to urge you all to think about the nervous system as a gland. And this is a sneak peek. I pulled certain slides from my foundations class for you all. So the nervous system secretes neurotransmitters, such as when you smash your forehead into the wall and it hurts, and substance P and bradykinin are being secreted by the nervous system into the local area and you feel pain. Or when you go to the electroacupuncturist and They stimulate your nervous system to secrete beta endorphin and ACTH in order to fix your problem. That's the nervous system. We can have input into the nervous system which nudges people towards health and nudges them quite strongly. This last line, response to electroacupuncture therapies. And this is so exciting. We have a neural input under our scope of practice using electrons. That just blows my mind. Besides the nervous system, I want to be clear about the acupuncture channel system, which Dr. Langevin has pretty much thoroughly researched and shown that the electroacupuncture channel system, yes, it does exist. It consists of muscles, fascial planes, and electrical flow through that. Now, the fascia is actually a semiconductor of some sorts, and it only allows electricity to flow in one direction, which is really cool. The skeletal muscle, which is also part of the acupuncture channels system with the fascia, it stores electrons and it also generates electrons. So when you're moving my muscle, my bicep, it's generating electrons in the frequency that I'm moving my arm. And the bicep itself is able to store that charge. That's pretty cool. So here's Dr. Langevin's slide, and she uses a very expensive microscope, and it shows the tip of the needle at the fascia and what happens when you spin the needle. Look at this beautiful spiral. I bet it's in the golden ratio spiral. Anyway, Dr. Langevin found that the needle pulls and pushes the fascia and other tissues. More than 40 things occur just by inserting a needle. The whole biochemical environment's changed. When you twist a needle or stimulate it with electrons, the fibroblasts secrete molecules into the surrounding tissues, such as ATP. So the entire system is piezoelectric. When it's tweaked, it emits things, such as electrons and other things. So we were talking about one of the ways to use electroacupuncture medicine is to modulate organ function. Well, in allopathic medicine, when they're talking about pharmacology, they categorize many of the prescription drugs into what it does to the autonomic nervous system. Will it increase parasympathetic or will it increase sympathetic activity? And we can think about acupuncture treatments and electroacupuncture treatments as doing similar. And so let's just go through the difference between the parasympathetic and the sympathetic. Now, this is overgeneralizing because there's actually two parasympathetics, one unmyelinated and one myelinated, but we will talk about that in the foundations class. So look on the left-hand side under the parasympathetic nervous system. This is your marijuana smoker, your narcotics, your heroin, analgesics, and endorphins. Look what it does to the eye. And on the right-hand side, we have what happens when you snort cocaine and you get all amped up and you increase sympathetic activity. These are the methamphetamines, the hallucinogens, the Ritalins, the norepinephrines. Now, if the sympathetic system is the gas pedal and the parasympathetic system is the brake pedal, you can step on both at the same time. I can swallow my barbiturates with caffeine or coffee. And I can also smoke marijuana and snort cocaine at the same time. And you'll get both an increase in parasympathetic and sympathetic activity. So before I came on here, Jeff told me there were 500 people. That triggered my adrenal glands to secrete norepinephrine, and I felt all amped up to get here. Let's move on, shall we? So this slide is pretty cool. You've heard that our cells regenerate. Somewhere along the line, you heard that our stomach, every 2 to 9 days is a new stomach, and every 3 days is a new intestinal lining. And somehow we heard that or I heard that and I just brushed it off. Yeah, that's too good to be true. Well, it's actually true. We get new cells every so often. I'm trying to look for another one here. Every 1 to 2 months is a complete new trachea. What? Yeah, our cells replace themselves over time. So if our cells replace themselves over time and I get a brand new set of every organ, why does the disease persist? And there's a couple reasons why the disease can persist. Either there's no raw materials for the cells to regenerate. In other words, they don't have the building blocks. They don't have the amino acids. Maybe there's a stomach issue and they're not digesting their minerals, their vitamins, their amino acids, and they don't have the raw materials to make the new cells. Then those cells are not going to be able to be regenerated. The other thing is that it needs electrons. This is where we, with our batteries, come in and our needles and give the system electrons. All right, let's go into the juicy stuff. And what I'm going to teach you tonight is a treatment that is like dosing somebody with a general analgesic. So if somebody with knee pain goes to an orthopedic doctor, they may inject cortisone into their knee, an anti-inflammatory. Or somebody comes to you and I want you to trigger the release of ACTH, which is a precursor to cortisol. And this cortisol will go directly to the knee and actually has shown to be more effective than the cortisone injections that the orthopedics give. Why? Why would our electroacupuncture cortisol-treated knee be superior to the orthopedics cortisone-injected knee? Well, that's because when the orthopedic injects the cortisone into the body, the pituitary says, whoa, there's all this. Well, actually, the hypothalamus says, whoa, there's all this anti-inflammatory steroid in my system. I don't need to make my own. And it shuts its own production of ACTH down. So it does not make any more anti-inflammatory on its own. Then the injection wears off, and there's no more exogenous cortisone floating around in the body, and the endogenous cortisol system hasn't started back up again. That sucks. So, beta endorphin. This is, all my patients get beta endorphin. It's an endogenous opioid. So, we have all heard about the opioid crisis, and it seems like they're ignoring the acupuncturist when it's been well researched and proven that certain types of acupuncture triggers the release of beta endorphin, which is endogenous opioid. Beta endorphin is made up of 2 different or more endorphins, enkephalin and dynorphin. Endo means internal, orphin means morphine. This is internal morphine. And by the end of the night, actually within the next 10 minutes, I'm going to show you how to turn your patient's internal morphine factory on, as well as their internal glucocorticoid steroidal anti-inflammatory pathway on. So endorphin's a strong and long-lasting painkiller. Competes with the same receptors as codeine, morphine, OxyContin, and many other opioid-based pharmaceutical drugs. And it's produced from the pituitary gland and released into systemic circulation. More biomechanisms. Now, I may have said this already, but I'm going to repeat it real quick. I don't have too many more slides for you. So, 20 minutes of low-frequency stimulation, like 1 to 4 hertz, upregulates the pituitary to produce more beta endorphin and ACTH. So during the treatment, it dumps these molecules into the blood and also back shuttles them into the hypothalamus to go directly to the cerebrospinal fluid and the central nervous system. And at the same time, increases the production of the amount of these molecules. Now these molecules, the painkiller endogenous opioid floats around in the blood. The blood's like a trucking system, and when the molecule reaches the tissue that needs it, the tissue that's in pain, it's going to link to those receptors and get rid of the pain. So the ACTH gets released in equal amounts to the beta endorphin, and that goes to the adrenal gland, and then the adrenal gland secretes cortisol into the blood, and then the blood is a trucking system which takes the cortisol to the inflamed area, and the cortisol moves out of the blood and into the tissues. Here's biomechanisms of the treatment that I'm about to give you. So now, if you didn't know already, now you know that 1 to 4 hertz is linked to the production of beta endorphin, which is my favorite painkiller in the clinic. I have others, but that's my favorite right now. Minimum of 20 minutes stimulation time. That means 17 minutes probably won't work as well. And if you go above 30 minutes, then you're going to get bad results. So these are all things that we teach in our seminars. Electro-acupuncture medicine is a framework in which you can take what you're already good at, apply the variables that we teach you, add electrons to your medicine, however you've been practicing, and increase your productivity, the way you help patients. So this, this low frequency stimulation, the pain relief doesn't start until after 20 minutes. So it takes a long time to get started, but once you get it started, it lasts a very long time. And that's because of what I told you, where the molecule dumps, during the treatment, the molecule dumps out of the pituitary, empties into the blood and the central nervous system, and immediately starts making more. It takes about 24 to 48 hours for this molecule to get where it's going. One treatment can last days or weeks. 3 to 5 treatments in a row triggers an immense increase in production of endorphin. That's the other thing. One treatment, the first treatment does a little, the second treatment does multitudes more, and the third treatment in the same week just blows them away and dumps massive amounts of these healthy molecules into their system. So there is a systematic review somewhere of the literature that shows 12 treatments in close proximity, and the patients were different for 3 to 5 years. They were making more of this healthier molecule for 3 to 5 years than before your series of 12 treatments. And here's the bonus. This same treatment, which I lured you in here to talk about the opioid crisis and how to produce endogenous opioids with electro-acupuncture, is also a major anti-inflammatory pathway. In my classes, I teach 2 different anti-inflammatory pathways. This is one of them. The other one's a catecholinergic anti-inflammatory pathway, which can be quite profound in itself. But we're going to be doing this low-frequency treatment on our patients, and we're also going to get the benefit of the anti-inflammatory. We're going to get painkiller and anti-inflammatory. Why are they ignoring the acupuncturist in the opioid crisis? Here's the boring part of the lecture. I'm going to speed things up a bit. Here's an ETO, and here's how you use it. Most machines have amplitude and frequency, and the top 3 knobs are all amplitude on this machine, and the bottom knob is frequency. Now, the frequency on an ETO ES130 is governed by the switch on the front, low, medium, or high, plus that knob, and there's a little chart there to figure it out. So if you want a 2 hertz, you put the switch on low and the frequency knob on about 5.5. Poof, you have 2 hertz. Amplitude is a variable that you need to spend a lot of time. I spend a lot of time on amplitude in my clinic. I even give them bells, and if the amplitude becomes too much or not enough, sometimes they have to ring the bell and call me back in. Amplitude is a tricky variable. You all know about frequency already, maybe. But there's about 4 or 5 variables that we're going to want to chart, and this is the only way we're going to get better.